You got told you have pulmonary hypertension and you're young. And here's the thing, your heart might be okay, or it could be compromised by the pulmonary hypertension as a secondary effect. If that's you, I want to say something clearly right at the start. Most of what's out there about pulmonary hypertension is written for an entirely different patient, an older person whose lungs are affected because their heart is struggling. That's not your situation, and that means the questions you should be asking and the question your doctors should be asking is different too. This video was requested by one of you, so let's go through it properly. I'm Dr. Jodie Ann Senior, a cardiologist and heart failure specialist. By the end of this video, you'll understand why pulmonary hypertension in a young person is usually a different clinical question entirely to pulmonary hypertension in the older patient, what the realistic list of possible causes actually is, and what a thorough workup should include, and why being managed at the right kind of centre actually matters enormously. Let's start with the most important thing to understand, because it reframes everything else. Pulmonary hypertension simply means that the blood pressure in the arteries supplying your lungs is higher than it should be. This is much like the arm pressure that's high in the doctor's office, except that this blood pressure here can't be taken at the arm because it's in your lungs, and we need a special catheter to test that inside your body. But that's it, that's the definition. Pulmonary hypertension is not one single disease, it's a category, a description of a physical finding with several genuinely different underlying causes. And those causes matter enormously because they can lead to completely different treatments. In an older patient, particularly someone who already has heart failure, pulmonary hypertension is very often developing because of left side of the heart struggle, and pressure backs up into the lungs, blood vessels as a downstream consequence. That's an important and common pattern, but it's not universal, and it's specifically less likely to be the explanation in someone who's young without pre-existing heart failure. When a young person is diagnosed with pulmonary hypertension and doesn't have an established heart failure diagnosis driving it, the far more important clinical question isn't, how is this affecting my heart? It's, why is this happening at all, on its own, at my age? And that's a genuinely different diagnostic path, and it deserves a proper answer. Let me give you a way to picture this that makes the logic a bit clearer. Think of your high blood pressure in your lung blood vessels like a traffic jam. In an older patient with heart failure, the jam usually starts downstream at the heart itself and the heart muscle, which is struggling to keep the traffic moving forward. So the cars back up behind it all the way into the lungs. In a young person without heart failure, the jam is often starting somewhere else entirely. Sometimes it's a problem with the lung blood vessels themselves from the very beginning, narrowed and or stiffened for reasons we need to investigate. Sometimes it's a structural difference in the heart that's been there since birth, quietly redirecting the blood flow in a way that gradually raises pressure over years, even decades, before it's ever detected. And sometimes it's connected to underlying autoimmune conditions affecting blood vessels throughout the body, with the lungs simply being where it shows up first. Same traffic jam, completely different reasons for it, and the reason is what determines the right treatment. So let's talk about the realistic list of possible causes, because I think that this is genuinely useful for you to know even before your specialist team has finished the full workup. Idiopathic or heritable pulmonary arterial hypertension is one of the most common findings in a younger patient when no other clear cause is identified. Idiopathic simply means we don't yet see an underlying trigger. It doesn't mean that there isn't one or that it's any less real or serious. In a small number of cases, there's a hereditary component, which is why family history might matter. Connective tissue disease associated with pulmonary hypertension is another important possibility. Conditions like scleroderma, lupus, or mixed connective tissue diseases are autoimmune conditions that can affect blood vessels throughout the body. And pulmonary hypertension is sometimes the very first sign that leads to a broader diagnosis. In other cases, you can see the signs of the secondary condition elsewhere. This is exactly why a thorough workup includes autoimmune blood screening, even if you haven't noticed any other symptoms. Congenital heart disease, which is associated with pulmonary hypertension, is a genuine possibility too, even in adulthood. A structural difference in the heart present since birth, sometimes something as small as a hole between two chambers, a hole in the heart, can very gradually raise pressure in the lung blood vessels over years, sometimes going completely undetected until adulthood. There's also drug or toxin-associated pulmonary arterial hypertension, connected to certain appetite suppressants and previous diet pills, or some illicit stimulants, amphetamine-based drugs. This is an important non-judgmental question that should be part of any thorough history, and it's always worth answering honestly because it directly affects the diagnostic picture. And less commonly, pulmonary hypertension can also be associated with significant liver disease through a mechanism called portal hypertension. Given that list, here's what a proper diagnostic workup should include. A right heart catheter. This is the gold standard test, and it directly measures the pressures inside your pulmonary arteries rather than estimating them. This is a special test done in a cath lab in a hospital. Autoimmune and connective tissue disease require blood screening. A careful echocardiogram specifically looks for congenital heart abnormalities, which can sometimes be genuinely subtle. And a ventilation perfusion scan or VQ scan, or a CTPA, CT pulmonary artery test, can check for chronic blood clots as a contributing or alternative cause. A specific detailed conversation about medications and substance history is important, and an assessment of your liver function, usually by ultrasound and blood test. If you've been diagnosed with pulmonary hypertension as a young person and this thorough workup hasn't happened or hasn't been explained to you, then that's a very reasonable thing to ask about directly. And here's the last thing, and it matters as much as anything else in this video. Pulmonary arterial hypertension is a specialized field. It is not something that every general cardiologist manages regularly, simply because it is relatively uncommon and the treatments are highly specific, being managed at, or at a minimum closely connected with, a center that has genuine PAH expertise, meaning a specialist team who manages this condition routinely, not occasionally, makes a real difference to both the accuracy of your diagnosis and the appropriateness of your treatment. This is not a criticism of any individual doctors, it's simply the reality of a complex specialized condition, and it is completely reasonable as a patient to ask directly, is my care being managed by or in consultation with a specialist pulmonary hypertension center? Let's bring this together. If you are young and you've been diagnosed with pulmonary hypertension without an existing heart failure diagnosis, the central question is not how is this affecting your heart? It's why is this happening at all? The realistic possibilities include idiopathic or inherited PAH, connective tissue disease, congenital heart disease, certain medications or substances, and less commonly liver-related causes. A thorough workup should investigate all of these, and your care should involve a center with genuine PAH expertise. You deserve a real answer to the question of why, not just a label. My free heart failure tracker stage guide includes questions worth taking to your specialist appointment. It's linked in the description below. And subscribe for a new video every week, all designed to give you the clarity that your appointment didn't have time to.